Okay, so first things first, I want to apologize for my dogs. It's raining outside, so they can't go outside. But my teaching video is on anaphylaxis. So, have you ever seen a person who's had, or in real life or in a movie, who's had like an allergic reaction? Sometimes that are shown of this is their skin turning red and the person grabbing their throat. They quickly have difficulty talking, standing, or even breathing. This is called anaphylaxis. There's an example I have. One time I was at Mexican and this lady started like across the booth, started like grabbing her throat, and I just was like, Dad. I was only 8 years old, but I was like, Dad. And yeah, she had this actual happen to her. Anaphylaxis is a life-threatening allergic reaction. This can happen in seconds or minutes with exposure to something you're allergic to. Some examples of things people are allergic to are peanuts, shellfish, penicillin, or bees. However, it can occur from anything at any stage of life. When anaphylaxis occurs, your immune system releases chemicals that cause your body to go into a shock. Then your blood pressure drops instantly, which is called hypotension. Your airways start to narrow, causing you to be unable to breathe. When this is happening, your pulse feels fast and weak. Sometimes when this happens, you can get a skin rash and feel nauseous to where you vomit. So the hypotension that happens can make your blood pressure drop so low that you can die. To further explain anaphylactic shock, I have a visual. So my visual today is 2 balloons. So one of them is going to have, there's water and food coloring in it, so I blew it up. And I was going to just use one, but I didn't want to have to hold it closed on my carpet. But, so this one has blood in it, which is representing your veins and arteries at the correct size. And then this one I'll show you, like when I blow it up, how it's supposed to, like how your airways look when anaphylaxis happens. So, like I said, the water represents your blood. As you can see, the balloon is full of water. I don't know if you can see that. Because the veins and arteries are the correct size. When you have anaphylaxis, your veins, arteries vasodilate or expand. So I'll go to this one. And this happens when you expand the balloon and fill it up with air. So like that. When your veins and arteries vasodilate, it reduces pressure for your blood so that it cannot move correctly. So like that, it can't move. See how the balloon or blood vessels are too big for the blood? This needs to be treated quickly. When you have like an anaphylactic shock, it has to be treated quickly because, like I said earlier, you could die. To treat this, you can be injected with epinephrine. Epinephrine is a hormone and neurotransmitter. Only a small amount is injected to your body, focusing on your nerves. It plays a part in your metabolism, attention, and focus. And when this is being treated, it relaxes your airway and muscles. So, like, here's another example. So, like, after you give in your body epinephrine, your airway relaxes and just like goes back to where it should be, like the how like big it should be. You need to, when this does happen, you need to inject this quickly because again, it can be deadly. This is why people who have known allergies carry around an EpiPen. Oh my gosh. But thank you. Again, I apologize for my dog. He's really bad.